Hi guys, my name's Ellen and I'm going to be your nurse here today. And this is RN Aware, a hopefully weekly show where I'm going to tell you things I wish you knew when you came into my ER. So this week's video is really just an introduction to who I am, what I do, where I'm coming from. I have a Bachelor's of Science in Nursing, which took me 5 years to get because I took the long way around. I have my RN because I passed my NCLEX on the first try, and I have my CEN, which means 2 years after I started working, I decided, what the heck, let's take another test, and I did, and proved to everybody that I actually know what I'm talking about in the ER. The ER I work at is in a suburban area. It's not right in the inner city, but it's also not way out in the country. It's somewhere in the middle. So a lot of people we get tend to be a very high acuity or really sick. Most of my patients have already seen their family doctor or PCP, urgent care, or their specialist, and were told, go to the ER because you're quite sick. So when I say somebody's sick, I don't always mean like a fever or pneumonia. Sometimes it means a patient is in heart failure and they need to get the extra fluid off. Or they have COPD and need breathing treatments or a BiPAP. Sometimes it's people with kidney stones who are just incredibly uncomfortable and can't manage the pain at home. That to me is what I mean when I say sick. So at my ER at any time, we tend to have anywhere between 5 to 7 nurses, 1 doctor, 1 NP or PA, and 1 to 4 techs, depending on the day. So my techs are similar to PCAs, but they have more skills under their belt. They can draw blood, do EKGs, insert Foleys, and they're able to splint broken bones, which my hospital system doesn't train nurses to do, just the techs. So at my ER, on average, we see about 75 people a day and admit 1/3 of them. My hospital is also a little bit limited. We're not a trauma center. We don't have pediatrics. We don't have OBGYN, which is anything to do with the female reproductive system. We don't have ears, nose, and throat. And I think there's a couple other things we don't have, but those tend to be the big ones that we run into a lot. So what that means for patients who come to the ER is if you need admitted for a problem with these specialties, pediatrics, OBGYN, ENT, that we transfer you to another hospital that's more appropriate. Same with traumas. We can stabilize, but then we ship out. So my goal for this channel is to educate you guys on what to expect when you come to the ER and how to be prepared if you ever do have to come to the ER. Hopefully none of you do, but things happen. My goal is really just to get some information out into the world that I wish people knew when they came into the ER. If you guys have any questions, I'm going to list my email address down below so that you can email me any questions you might have, and hopefully I'll be able to answer them for you. Alright, make sure you take your medicine, drink your water, and I'll be back in a little bit to check on ya.